Alright guys, I want to tell y'all something. See them little things she's got right there? That's their new form of respiratory therapy, okay? Where you used to cup the hands and beat on the back and beat on the chest to break that shit up. No. They use one of these now. Let's say you got to blow hard on this. Let me see one of those things, and I'm going to demonstrate how this thing's supposed to be done. Now remember guys, I got COPD. According to the doctors, had it for years and years, okay? So, y'all see the little smiley face there where my thumb is? When you don't blow on this one, you suck in. As you suck in, you want to keep this little green thing between those two areas at that smiley thing, at the smiley face. It's really hard to do because if you don't suck hard enough, it stays down too low. If you suck too hard, it comes all the way up or too far up. Okay, but let me just see. This one here is kind of bent. What does she do? What does she do? That's their respiratory therapy for after surgery, guys. Here, let me hold this one right here. Let me show them this other one. And this one right here. This one you blow in, okay? This is so bogus, so bogus. I've tried it. Now, let me see. Here, let me record me right here. Record me. Okay, can you see? Look at the camera there, at the lens there. I'm trying to get close so they can hear this. What this is supposed to do is supposed to jug your lungs. Now, I do the thing, boom, 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 on the back and on the chest, boom, 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 and that's how I broke that shit up out of you. That medicine just wasn't cutting it, was it?
No.
Now, the medicine helped, guys. That medicine was where they're choking with me doing that at the same time, it got that shit up. But in the hospital, they just want to use the medicine. They use this shit right here. They replace the palpations on the back, bam, 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 and on the chest, along the lungs, to break that shit up with this. This is a joke, okay? I tried it because, listen, like I said, y'all seen what I did with that thing there. I was diagnosed with COPD years ago, but listen, I've had where I clog up colds or anything, I get clogged up, and then I know how to get that shit out. I even got this vibrator I use. Now that one there kind of makes you a little sore, but it breaks that shit up. You do it with your hands, here and on the back, it breaks it up. This is what the medical society has replaced actual respiratory therapy with. This and medicine. Now, this one y'all blow on. Now, I can feel that a little bit as it's making my breath go in and out like that. But it's nothing. Now, if you use this and this, it might. Because if you that medicine they use, that medicine was some nasty shit. Lindy, do you remember what that shit tastes like? I tasted it and I was just in the fucking room. That shit was nasty. They put some real strong medicine there. She couldn't breathe at all, man. That shit was bad. And I did what I call respiratory therapy from the old school. And the respiratory therapist doctor was sitting there watching me do it and just grinning like a motherfucker. Grinning, and told the nurse, looked at the nurse, said, maybe we should ask for an order to do it. And then they looked at me and said, we gotta have an order to do it. I'm like, what the fuck you mean? You are the respiratory therapist. You're the doctor of respiratory therapy. They're the doctor of surgery. There's a difference. What do you mean you gotta have the order? That shit was stickling. Do you remember that? Huh?
Not really.
You don't remember me doing the palpations?
I remember you doing the palpations to me.
And was it better or worse? What do you remember about it?
I remember you doing the palpations because I asked you to. I remember coughing up some phlegm, but I don't remember too much.
They put
more.
The medicine on you while we was doing that. The nurse helped me do it. The respiratory therapist came in and put that medicine on you, and that shit helped too, man, with the vibrating we did of the lungs, because that shit just wasn't coming out of you, man, and still barely, man, you're just barely getting it. All right, guys, I just wanted to show y'all what their new method of respiratory therapy is. This and this, which this wasn't doing or worth the crap. I'm telling y'all guys, see the green thing where the green marker is? That's as far as she could get it now. Last day or two I've had her up working, and today she did all the laundry, did the dishes, and she was able to make that thing go up quite a bit. but today's the first day. When she was just using this, nah. They say this gets you off by oxygen, builds your lungs. Nah. Better get out there and do some work. All right, with that, I'm out, guys. Go ahead and hit the red button, turn it off.